Let's start topic pelvis. Have you ever wondered how our body is able to stand upright, walk smoothly, and even give birth to a baby? The answer lies in an important bony structure called the pelvis. It acts like a strong basin-shaped support system that connects the spine to the lower limbs, protects vital organs, and plays a crucial role in movement and childbirth. Understanding the pelvis helps students better learn about the process of normal delivery. Introduction. The pelvis is a basin-shaped bony structure located at the lower part of the trunk between the abdomen and the thighs. It connects the vertebral column to the lower limbs and supports the weight of the upper body. Bones of the pelvis. The pelvis is formed by 4 bones, 2 hip bones, right and left innominate bones. Sacrum, coccyx, 1 hip bone, innominate bone. Each hip bone is formed by the fusion of 3 bones. Ilium, upper broad part. Ischium, lower posterior part. Pubis, anterior part. These bones join together at the acetabulum, where the head of the femur forms the hip joint. 2. Sacrum, a triangular bone formed by the fusion of 5 sacral vertebrae, located at the back of the pelvis, connects the spine to the hip bones. 3. Coccyx, also called the tailbone, formed by 4 fused vertebrae, located below the sacrum. Pelvic joints. Important joints of the pelvis include 1. Sacroiliac joint, between sacrum and ilium, strong joint that transfers body weight to the legs. 2. Pubic symphysis, a cartilaginous joint between the 2 pubic bones, slightly movable, becomes more flexible during pregnancy and childbirth. 3. Sacrococcygeal joint, between sacrum and coccyx. Divisions of the pelvis. The pelvis is divided into 2 parts. 1. False pelvis, greater pelvis. Upper part, supports abdominal organs such as intestines. 2. True pelvis, lesser pelvis. Lower part, contains pelvic organs. Examples of pelvic organs: urinary bladder, rectum, uterus in females, ovaries and fallopian tubes, pelvic inlet and outlet. Pelvic inlet, upper opening of the true pelvis. Boundaries: sacral promontory, posterior. Ilium's lateral. Pubic symphysis, anterior. Pelvic outlet, lower opening of the pelvis. Boundaries: coccyx, ischial tuberosities, pubic arch. These are very important in obstetrics because they determine whether normal delivery is possible. The male and female pelvis differ mainly in shape, size, and function. 1. The male pelvis is usually narrow, deep and heavier, with a heart-shaped pelvic inlet and a smaller subpubic angle, as it is mainly designed to support body weight and provide strong muscle attachment. 2. In contrast, the female pelvis is wider, lighter and shallower, with an oval pelvic inlet and a wider subpubic angle, which helps in childbirth by allowing the passage of the baby through the birth canal. Thus, the female pelvis is specially adapted for pregnancy and delivery, while the male pelvis is primarily adapted for strength and support. Functions of the pelvis. The pelvis performs several important functions. Supports body weight, protects pelvic organs, bladder, uterus, rectum, provides attachment to muscles and ligaments, helps in movement and walking, forms birth canal during childbirth. Clinical importance, important for nurses. 1. Childbirth. The size and shape of pelvis determine normal delivery. A narrow pelvis may lead to obstructed labor. 2. Pelvic fracture. Common causes: road traffic accidents, falls, trauma. Symptoms: severe pain, difficulty walking, internal bleeding, may be life-threatening. 3. Pelvic organ prolapse. Weak pelvic muscles may cause organs such as uterus or bladder to descend. Common in multiple childbirth, old age. Important landmarks of the pelvis. Some important anatomical landmarks are iliac crest, anterior superior iliac spine, ASIS, ischial tuberosity, pubic symphysis, sacral promontory, acetabulum. These landmarks are important in clinical examination and obstetrics.